Hi, today we're going to be going over the orthotic scanner that we have in our office. Many patients come in with foot pain every day for many different reasons, whether it's just overuse of being on their feet or they have issues such as bunions or plantar fasciitis. Basically what this scanner does is utilizes technology hooked up into this plate. There are over 4,000 sensors. It's connected to a computer and it will analyze your gait as well as your standing static stance. So from this, what we can gain is information in order to make an orthotic to correct whatever issues you may have been going on. So let's get started with the scan. Okay, so we'll have you take a step on the plate there. I just need you to stand naturally and look straight ahead for me. Stand how you would normally stand. I'm going to just take a little picture here. You want your foot to look like this guy's foot as far as the coloring there. The light yellow coloring means that you don't put a lot of pressure in that area. Green is more of a moderate and red is a lot of pressure. As you can tell, this is your right foot here. You have a lot of increased pressure into your heel and also into the front of your foot. Also, you put 51.9% more weight on your right foot as opposed to your left with 48.1%. And also you have an increased pressure here to the back. So basically, I mean, you're having a lot of issues with your feet there, so this would be a good thing for you. So here's what we found with his walking scan. Over here is an optimal sample scan. Basically what you're looking for is not a lot of increased red because that shows increased pressure with your walking. This black line here is your gait path. So from heel strike to toe off, you would like it to look smooth and the weight be distributed all the way through the foot like this. A nice even line. So over here we have the patient's feet. The right foot, you can see his line is not curved like it should. His weight isn't being distributed as the optimal sample is. He also has a lot of increased pressure in the back part of his heel with this increased red and the front of his big toe and also the side of his foot. Same thing with the left foot. So what we determine with this scan is we send this information to a company called the Orthotic Group out of Canada. They take this information and they make a customized orthotic to fix the problems that you have going on with your feet. These are just two examples. So the computer would take the information and depending on what kind of shoe you wear, if you wear a bunch of different kind of shoes, you would have an orthotic like this, but they would customize it to correct your problem with what you have going on with your feet. If you're more of like a work boot or a full-length shoe, this is the orthotic they would use. We can help all types of patients, from athletes to workers to the average housewife. So please give us a call, come by, get your foot scanned.